How are you?
Good, how are you?
Good. I have the CHF patient. Her name is Priscilla Bobastra. She's complaining of chest pain. Blood pressure's a little high and respiratory rate's a little high as well. Doctor, order a sputum sample. Can you take care of that for me?
Sure
Thank
can.
you. Let me know when you're done.
Yeah, no.
Yes.
Hi, may I come in?
Yes.
Hello. My name is Junior. I'm with Respiratory Care. I understand you're having some issues breathing of chest pain.
That's not what happened.
Yeah, and it feels really tight in my chest. It's really hard to breathe right now.
Okay. Well, we'll see what we can do to help you out, okay? That's okay with you. Can we turn that down a bit?
Yeah, I'll just turn it off. Let's speed it up though, because that's my favorite show.
Okay. What show were you watching?
General Hospital, the best.
Is it? I've seen that show. It's a pretty cool show.
Yeah, it's really good. It's my favorite. I used to sit around and watch it with my mom when I was little. Do you have a favorite show?
I do. Breaking Bad?
Did you watch that with your dad?
No. I watched it with my son. So, I'm gonna check, if you don't mind, your wristband. Can you see your hand? Can you say your full name for me?
Priscilla Bobastra,
And your date of birth.
February 28th, 1922.
Great, thank you very much. Okay, Ms. Barbastro, it seems like your heart rate and blood pressure is a little bit up. So they want us to do an assessment on you to make sure everything's in working order. So I'm going to start off by looking at your feet, actually by your ankles, if you don't mind when I look at that.
Yeah.
Okay. All right, so what I'm doing now is I am looking for a pitting edema or swelling, and it seems like this patient does have quite a bit. It's actually at a +3, meaning there's about 3 seconds before it comes back out flush. Okay, Mr. Bosser, I want to check your fingertips as well. You can do one hand if you want. May I see this one? And now I'm checking for digital clubbing, which is also swelling at the fingertips. And I'm also going to check the palms as well. Seems like she does have quite a bit of swelling as well. You can go ahead and chart that. Okay, Ms. Barbastro. If you don't mind, I'm also going to check your stomach or your abdomen for any kind of tenderness or soreness. So if you don't, I'm going to touch your belly, okay? Let me know if something hurts or it starts hurting, okay?
Oh.
That hurt?
Yeah, don't touch there no more.
Okay. Ms. Foster, if you don't mind, would you mind sitting now? I'm going to check your test. So go ahead and put your feet towards me. Okay. All right, so what I'm going to start off is by checking your trachea to make sure it's down the middle and it's not shifted to one side. So if you could look up for me. Okay, seems like it's in the right position. Okay, I'm also going to palpate your chest. I'm going to do percussion. That means that I'm going to check to see that, make sure there's no gunk or there's nothing going on with your lungs. Okay.
Okay.
Okay, seems like both anterior sides, so both right and left lungs are showing normal percussion notes. I'm also going to do a what is called a vocal fremesis. So I'm going to touch your chest, and if you could say 99 every time I touch it. Go ahead.
99. 99. 99. 99. 99. 99.
Okay, great. All right, if you can look that way as well. So the vocal fermentis was also normal. I could feel the vibrations. If there was consolidation or if there was trapped air, you wouldn't be able to feel it. Okay, now I'm going to check her spinal column for any deformities or abnormalities. Looks like it's straight, no signs of any kind of deformities. I'm also going to palpate the posterior side of the chest. Okay. So again, we get normal percussion notes as well. I'm going to do the same thing if you can do 99 for me every time I touch your chest or the back, okay?
99, 99, 99, 99, 99, 99.
Okay, perfect. Thank you very much. One last thing I did want to check as well. You can look that way. You can see the neck veins are distended. Again, another classic sign of CHF, and that's caused by what we call cor pulmonale, which causes like a backage of blood. The pressure will distend out the neck vein, and again, that's another sign of CHF. Okay, so if you want to go ahead and sit down now for me. All right, thank you very much. Now, looks like your doctor, your physician, ordered a sputum sample. Okay, so in order for us to do that, we do need you to clear out your throat, take a deep cough, and cough up as much sputum as you can into this cup. Can you do that for me? Thank you very much. All right, so I'm going to take this over to the lab, okay? And I'm going to go ahead and have the nurse come in shortly, okay? And before I leave, I'm going to go ahead and wash my hands. Hey, Sydney, how are you doing?
Good.
So I'm finished with this patient. Here's a chart. So I did find some pitting edema in both of her ankles, some digital clubbing. Her neck veins are distended. Her lungs, although seem healthy, no problems at all. So I do recommend a chest X-ray to make sure that the CHF hasn't been exacerbated. Other than that, I'm going to go ahead and take this over to the lab and get it tested.
All right, perfect. I'll go ahead and get on the chest X-ray.
Okay,
Thank you.